Our last speaker of the evening, so last but not least, certainly, is Dr. Afshin Abrishamkar. Dr. Abrishamkar's research specializes in developing microtechnology based platforms for biomedical and healthcare applications. This includes tissue engineering and drug delivery. He was once called a citizen of the world by a very wise man. And although I don't know if I'm quite as wise as that man, I would certainly agree with that sentiment. In tonight's presentation, Dr. Abrishamkar investigates revolutionary developments in cancer therapy. When facing a devastating disease such as cancer, treatment options might actually be very limited. Many turn to things like chemotherapy or radiotherapy as popular choices. But is there another option that could potentially be more comfortable? Join Dr. Abrishamkar as he unfolds this very important question.
Thanks, Katie, for the introduction. Good evening, everyone. Thanks for staying through the last presentation. I appreciate that. So, as Katie mentioned, I'm going to talk about a couple of more recent and revolutionary treatments in chemotherapy besides the traditional chemotherapy and radiotherapy. Before diving into the treatments, let's talk about how dangerous cancer is. We are all familiar with cancer, but just to look at some statistics, last year in Canada only, over 230,000 Canadians were expected to be diagnosed with cancer, and 85,000 were expected to die of cancer. So these are huge and sobering numbers, but in order to make them more tangible, it means that every day, over 600 people were diagnosed and over 200 people died of cancer. And even going further with that, every hour, 27 Canadians are learning about their cancer and 10 lose their job, lose their life and cancer. It means that including the families, friends of the patients, over 1 million people face some challenges with cancer. So it kind of affects over 1 million people in Canada, and it's only for last year, and it's growing. And it is also based on the Canadian Society of Cancer, is known as the leading cause of death in Canada. So out of 4 people, one of them who die of cancer. And it's not only for other people, it's closer, unfortunately, to what we think. So around 40% of Canadians are expected to develop some sort of cancer during their lifetime, which means out of every 5 people, 2 of them will develop some sort of cancer during their lifetime. And despite of all these challenges and issues that we have in cancers, the more common therapies these days are radiotherapy, chemotherapy, and also surgeries or in some sort of combination of these. However, they are being used in clinicals, but there are also some challenges with that. Just starting with chemotherapy, it was pioneered in 1940s, so over 80 years ago. So it is an old treatment, although it has been refined consistently during the last 80 years, but there are some issues with it that we will get into. But also there's an interesting story behind this chemotherapy. You might have heard this, wherever there's a bad, there's always good nearby. This is actually true for chemotherapy. So it all started with the World War I. So about 100 years ago, there was some warfare that was used, the mustard gas and deadly agent that was used for deadly effect. And after about 2 decades, with the advent of World War II, there was some concerns raised about reintroduction of these chemicals. So actually people decided to shift toward looking into more research about therapeutic applications of this chemical, which was called mustard gas. So this research actually led to the discovery of another chemical that's called nitrogen mustard about 2-3 years after that. And that chemical was actually learned to be something that could be used for chemotherapy. And about 80 years ago, chemotherapy was born. And since then, over the last 80 years, it's been refined considerably, and it is still one of the mainstay for treating cancer today. However, as I mentioned before, there are some issues. Just to start with, do you know anyone who likes needles? Everyone hates needles. No one likes to be poked. And unfortunately, some patients of cancer, they have to be treated with administrative drugs using needles even up to daily. So just imagine that. It would be very painful and uncomfortable. But besides this, there are also some other issues with it. For example, in chemotherapy, usually they use the highest tolerable dose of drug. And this comes with a lot of side effects. And also, it compromises the patient's general health. And considering that we are using the highest tolerable dose, but it's still only less than 1% of the drugs reaches the tumor. So 99% of the drugs don't even make it to the tumor. So knowing that, we need some improvement in this field. So this can be the only option. And if you want to do something in it, the improvements that we require should lead to providing a more efficient way to deliver the drugs into the tumor, so it could penetrate deeper into the tumor uh, microenvironments, and also it should bring less discomfort for patients compared to the chemotherapy. So if you're looking for new ways and revolutionary treatments for cancer, it should meet three different criteria. So to be able to call it efficient treatments. First, obviously, it should have increased response rate. So more patients should be treated when they undergo that treatment. And also it should bring less side effects compared to the ones that we have now. And the third one, it should definitely reduce cancer mortality, which is quite high at the moment. Knowing these three factors, we should be looking at this area that all these have in common. So this is the area that we should be looking at newer and more developed treatments for cancer. So here are a list of some of them. Now we are studying with the microtechnology and nanotechnology as a promising methods for cancer therapies. Microengineering and microtechnologies led to a new treatment that's called immunotherapy. It is not yet in clinical trials, but it is a very promising one and is coming to trials soon. Next, nanotechnology, going to a smaller scale, led to another method that's called chemotherapy loaded nanoparticles. It is already in clinical trials, this one, and is being used. In this case, for example, using gold nanoparticles, we would load the drug into the nanoparticles, and because they are super small, they can easily travel through the body and go into the tumor, and they can penetrate deeper, what we couldn't do without it. And then another one, which is definitely the most used clinical therapy at the moment, is the liposomal anti-cancer drugs. This is already in clinical trials and it is very promising, but it's not the end. So we need more. The area of greatest potential for treating cancer is probably in more complex nanotherapies, still within the nanotechnology, but in a little bit more complex nanotherapies. What do we mean by complex nanotherapies? So it means that we somehow combine the drugs with the possibility to image the cancer as it happens, and also to heat generation being able remotely. So what does this mean? It means that we can administer the drug, so these drugs will work and it will kill the cancer cells that are very fast growing. And at the same time, we are able to capture what is happening there. So it would be very cool to see if the drug that we administered can make it to the tumor and if it can do something for the treatment. And lastly, but not least, we all know about the mRNA vaccines due to the COVID a few years ago that we became familiar with. So it would be very cool if you would have something similar to that for cancer. There's actually some interest and some early success in using mRNA or cRNA methods for cancer treatments. So it would be very cool if you could make something for that for cancer. However, I want to make sure that it doesn't exist, unfortunately, at the moment. But it's very promising, and there are so many interesting research going on that. So hopefully, at some point in the near future, we will hear some good news for that. At the end, I want to say that the cancer is still there, and the fight against cancer still ongoing. So to make this more clear, over the last 10 minutes of this presentation, unfortunately, 5 people just got diagnosed with cancer, and 2 people died of cancer. And this is only for Canada. It is very sad, very sobering, and it's a huge number. But I don't want this to be the message that you take with you today. So just focus on this. Although there is these issues, but there are lots of other treatments on the horizon that are less uncomfortable and more efficient than the current one, chemotherapy and radiotherapy. So let us all be hopeful and keep our fingers crossed for these methods to come into the clinical trial. With that, I would like to thank you all for your attention and also for your kind attention at this time. And if there would be any question, I would be more than happy to take.
Wow. Thank you so much, Dr. Abrishamkar. So much to think about. I think this is really a topic that resonates with many, many people today, as you noted in your numbers. So a question from our audience has come in. The thought of a cancer vaccine sounds very exciting. Do you think that it might be met or received or even accepted by the public? Or might there be vaccine hesitancy like we saw with COVID-19?
That's a very interesting question. I think it is one of the questions that we can't answer for sure until we face it. So I would say whatever I would say, it's just my opinion. I think compared to COVID, it should be less hesitation and resistant against it because, firstly, cancer is a more known illness or disease than COVID. So for COVID, there was not so much information around it. It was not known to population, so there was more resistance. Also, the treatments that were coming into clinical trials, they were not developed or researched for like long-term side effects. But I think for cancer, hopefully, because of the issues that we all are familiar and we are probably seeing around us, I'm hoping that it will be less resistance for that. But we will never know until we come to that.
Thank you so much. Great answer. There's actually a kind of a two-stage question, shall we say. Would nanotherapies be a cost-effective way of treating cancer? And would it be cheaper than chemotherapy, which is extremely expensive?
So that's a very good question. I think as long as these are in clinical trials, it will be hard to predict. But I guess, yes, it's going to be cheaper because you will minimize the amount of drugs. And also considering that in chemotherapy, 99% of the drugs that we use, they're not actually effective. So yeah, definitely we're going to be saving it a bit more.
Thank you so much, Dr. Abrishamkar.